in Miami for Stand Up for a Cure, helping support, breast cancer survivors and raise awareness. For me personally, it hits home. I lost a sister to breast cancer, so, love coming out here and supporting the women.
I was 34 years old. I was just turning 35 and I had early stage breast cancer. So what was I going to do? I had a little bit of a better chance to fight it. I had chemo, but before that I had double mastectomy and then I had reconstruction, and here I am today. I have subsequently screened for ovarian cancer and I had my ovaries removed in May to preserve my life. My mom wasn't as fortunate. She was diagnosed again 2 years ago and now she's stage 4 metastatic breast cancer to the lung. That's a lot. Had they had the information that they do today, back then, she wouldn't be sitting here with stage 4 metastatic breast cancer to the lung. I'm going to say it as many times as I can because it's a lot. Maybe she'll live 5 years, maybe she'll live longer, maybe not. But she's living, and all you can do is treat it like a chronic illness at this point. But what we should go back to is early detection. If you can reduce your risk and catch it early or not have it at all by screening, and if you're at risk, possibly having the genetic testing, you can have a prophylactic mastectomy to preserve your life, possibly. I've had friends do that whose families have been affected. I think life is worth preserving and do what you can to fight for it. The doctors are there to help you, but you have to be your own best advocate. So we're here fighting for lives and having a good time in the process.
If you're screened early and you catch this disease in the early phases of this disease, it's survivable. The survivor rate of 5-year survivor rate, if you get breast cancer and it's contained within the breast, is 99%. In 1982, that survival rate was 74%. So you can see the leap we've made with medicines, researches, new treatments, new ways of looking at breast cancer. But it's all about getting screened early. The biggest thing we fight here is fear. People are scared to find out. There's a lot of single moms out there. They've got a lot of stuff on their plate. People are struggling in this economy, and in their mind they're thinking, I found a lump, but I just can't deal with it right now. I've got the kids, I've got the mortgage, I've got this. But the message we're trying to get across to them is, go deal with it now, because if you deal with it now, you're good chance you'll survive it. If you keep putting it off and putting it off and putting off, and if it is something bad, if it is breast cancer, you've taken years off your life. If you have children, if you have a family or loved ones that care about you, take the time to talk to your doctor and get screened as soon as you can get screened. That's the message.
Been a great event here for Stand Up for a Cure in Miami. Come out and check it out in 2016, and we'll see you then.